Welcome to the deep dive. Today we're zooming in on something pretty small but really important in your neck.
The thyroid gland.
Exactly.
Yeah.
That little butterfly-shaped thing.
Yeah.
It has, well, huge control over your whole body.
Yeah.
We've been looking at info from Blood Test UK.
Right?
And we want to understand why the usual tests might not be enough and why, getting a more advanced test is maybe a really good idea for your health.
It really is.
So our mission today is to figure out what these advanced tests actually show us and why knowing that stuff is like a big win for staying healthy long term.
Yeah.
Okay, so the thyroid's basic job, right? It makes these hormones, T4 and T3, and they're kind of like the body's gas pedal. Control the energy, how fast you burn calories.
Spot on. Metabolism, basically. How fast everything runs. If it's slow hypothyroidism, you might feel tired, cold, maybe put on weight for no reason. If it's too fast, hyperthyroidism, you could feel anxious, heart racing, maybe lose weight without trying.
And these things can sneak up on you.
Right.
That's what the Blood Test UK material suggests.
Exactly. It's often slow. You might just think, oh, I'm just tired or I'm stressed.
Which is why maybe the standard test isn't always catching it. What's the issue there?
Well, the standard test usually just looks at TSH, thyroid stimulating hormone.
Okay.
Think of TSH like the boss calling from the main office, the brain telling the thyroid factory how much work to do.
Right, like make more stuff or slow down.
Precisely. But just hearing the boss shouting doesn't tell you if the workers on the factory floor are actually doing the job properly or if they even have the right tool.
Okay. So the workers, those are the actual hormones like T4 and T3.
Yes, specifically free T4 and free T3. That's what the advanced tests look at.
Why free? What does that mean?
Good question. So most T4 and T3 in your blood are stuck onto proteins, kind of like they're being carried around but can't do anything.
Okay.
The free ones are the hormones that aren't stuck. They're free to actually get into your cells and do their job, control your energy.
So they're the ones that actually matter for how you feel.
They're the active ones, yes. You could have a TSH level that looks okay, but if your free T3, the most active hormone, is low, you might still feel awful.
And the standard test would miss that.
It could, yeah.
Wow. Okay, so advanced tests check the boss's signal and the active workers.
Yeah.
But they also check something else. Antibodies.
Yes, and this is a huge benefit. Huge. Antibodies, like the ones for Hashimoto's or Graves' disease, show that your own body, your immune system, is attacking your thyroid.
Oh, wow.
And here's the key thing. These antibodies can show up years before your TSH or your free T4 and T3 levels actually go really wrong, sometimes decades.
Years. So you could know way in advance.
Potentially, yes. Finding those antibodies early means doctors can help you make changes before things get bad.
Like what kind of changes?
Well, it might not just be about thyroid pills right away. It could be changes to your diet, managing stress, maybe making sure you get enough nutrients like selenium or iodine, things that might help calm down that immune attack.
So it's not just about getting the right diagnosis, it's about getting it early and maybe even preventing bigger problems down the road. That's a massive benefit.
It really is. Better accuracy leads to treatment plans that are actually tailored to you, focused on prevention and managing things better long term.
And getting these tests, is it difficult? The info from Blood Test UK, especially thinking about places like Brierley Hill, suggests it's getting easier.
Much easier. You can often get these comprehensive tests through local clinics, hospitals, and there are even reliable at-home test kits now. Access isn't usually the main hurdle anymore.
It's knowing why you need the more detailed test.
Exactly, knowing to ask for it or to seek it out.
Okay, so let's wrap this up for everyone listening. The big takeaway seems to be, don't just settle for the basic check if you're having symptoms. Investing in that advanced test checking, TSH, free T4, free T3, and antibodies gives you really important information.
Crucial information. It could stop a small issue from turning into something much bigger, like heart problems or ongoing energy issues. And there's something else we should mention, something Blood Test UK's resources also touch on. It's the link between your thyroid and how you feel mentally.
Yes, like mood.
Absolutely. Things like ongoing anxiety, depression, even brain fog. Sometimes these aren't just psychological. The root cause can actually be a thyroid problem that hasn't been properly diagnosed.
That's a really powerful thought.
It is. So here's something to think about. If you, or maybe someone you know, is dealing with mood swings that don't make sense or just feeling exhausted all the time and nothing seems to help, maybe, just maybe, the answer isn't only in the mind, but in the body's hormones. That advanced thyroid test might just give you the clarity you need.
Really important point.
Yeah.
Use this knowledge, ask questions, and take charge of your health. Thanks for joining us for this deep dive.